Now I am going to discuss about the palpation of thoracic spine on the basis of scapular orientation. So first of all, we have to position the patient in a erect sitting position. The patient should be in erect posture and both hands should be supported in the lap or over the thigh. So patient is already positioned, subject is already positioned. Now I have to palpate. I have already marked here some landmark which is used for reference. So first landmark is the superior angle of scapula. Second is it is at the level of spine of scapula, and third is it is at the inferior angle of scapula. Both sides I have already marked, but let's start from the beginning. How to identify the superior angle of scapula? First of all, here we can see the contour of the scapular region. If you are not able to identify it, just modify the position of the shoulder or limb. Now it is getting out. The medial border of the scapula and inferior angle and the lateral border, all these landmark is getting out. Relax. If you are not able to identify it, you can place your finger like this on the inferior angle of scapula, or you just follow the medial border of scapula in upward direction. Okay. So this is the level of superior angle of scapula, and this is your inferior angle of scapula. So just identify it and again make it the patient in neutral position or erect sitting posture. Another method to identify the superior angle of scapula. This is the orientation of your trapezius and levator scapulae. So you have to place your hand somewhere at the base of the neck and slide it downward direction obliquely. Like this, patient will relax, maximally relax, and then it will strike over the superior angle of scapula. Already we are getting an idea about the location of the medial border and rest of the bony landmark. According to the observation, we can just get an idea about the superior angle of scapula. So just slide your finger pad in oblique manner like this, and ultimately it is striking over the superior angle of scapula. So just mark the superior angle of scapula. Same procedure we can repeat another side. I have already marked it, the superior angle of scapula and other side. Next is this is the level of spine of scapula. So for the identification of spine of scapula, either you can start with direct method. You can place your hand like this, slide it down, and this is striking over the upper lip of the spine of scapula. Or you may choose another method that you can start your palpation from the angle of acromion, which is found just posterior to the shoulder joint. So whatever the convenient for you, you can choose it. So this is very easy to identify. It is subcutaneous structure. So I just palpating it and following the lower lip of the spine of scapula. And here again I have already marked the level of spine of scapula. This side is also marked. Already it is marked. Same procedure will repeat another side. The inferior angle of scapula, it is very easy. I have already discussed. Just ask the patient to just modify the limb position. Identify it and again ask the patient to make the previous position or assume the previous position. So this is the inferior angle of scapula. All these referencing landmark of the scapula is already marked. Now you can draw a line which is connecting the both side of the superior angle of scapula. Like this. It is little bit oblique, but Here I have already marked. It should be in center. So palpate it. Just apply a oblique or cephalic pressure in upward direction like this. Your finger position should be oblique because the orientation of the spine of spine of thoracic spine is downward or oblique downward. So you have to position your finger according to the orientation of the thoracic spine like this. Same way, you just connect the both sides of the spine of scapula, which is already marked. Again, it is little bit oblique. It is not a straight line. And here you can see that I have already marked here because I can feel two spinous process. One is here. The location of one spinous process is here. Another is here. And the distance of this spinous process is little bit away from the intersecting the line. Okay, so this may be your C2. Another spinous process is found here. So it is more close to this line. So it may be your C3. But again, as I have discussed, that this palpatory technique is less reliable method because the scapular position could be altered person to person. In patient, all those patients who have any pathology or any problem around the shoulder girdle, in all those patients, the scapular position could be altered. It could be shifted anywhere, in upward direction, in lateral direction, or even in medial rotation. So all these referencing landmark could be shifted in any direction. So that's why this could be the reason that the landmark is not found close to the line or the line intersecting it, it is not found underneath of that line. Okay, so here it is T1, it is T3 and it is T7. So how many segment is missing? Between these two spinous process, one segment is missing, that is T2. From T3 to T7, how many segment is missing? 4, 5 and 6. So let's start the palpation of 4, 5 and 6. Already it is marked. Again, place your finger over the spine. It should be in oblique direction, in upward oblique direction. I can feel another spinous process over here. So it could be your T4. Next, slide it down. Again apply and try to feel the bony prominence or edge of the spine. This is again found here. This could be your 4, 5. This is again slide it and try to identify another spinous process. I can feel over here. This is T6 and T7 is already marked. Slide down, try to identify. This is your T8. Again slide it down, identify the bony edge or bony prominence over here. This is T9. Slide from here and apply oblique pressure. This is the level of T10. Slide down, try to feel the another bony edge or prominence, that is T11. Slide it down, try to identify the, and this will be your T12. So basically this is the method to identify the spinous process of the thoracic region, but again it is very less reliable method for palpation of thoracic spine. That's all.